We use an elimination diet to determine whether your pet might be eating something that is making them feel itchy or get recurrent skin infections, ear infections, paw licking, all those kinds of things. My name is Dr. Alex Moore and I'm a veterinarian specialising in dermatology. An elimination diet is used to try to figure out whether your pet has an allergy to food, so a protein most commonly. An elimination diet is a very strict diet and we perform it using a novel protein. So a novel protein means a protein that your pet has never been exposed to before. So crocodile, kangaroo, wild boar, they're the sorts of proteins that aren't commonly found in your regular dog foods available, and so that would be appropriate case by case for an elimination diet trial. We need to make sure it's not something that is poultry based, so chicken, duck, turkey and egg products, beef, lamb and dairy. So they're the big, most common food allergies in dogs that we see today. So while it may feel like an interrogation when your vet is asking you for a complete history of all the meats and proteins and foods that your dog has eaten throughout its life, it is really important, because if they have had a protein before, it's no longer novel, therefore it's not appropriate for an elimination diet. An elimination diet we use for a period of 8 weeks and no less, and we feed them a novel protein and only that throughout that period of time. The way to keep the dog interested in a diet for 8 weeks would be to change the format that you're offering the diet. So for example, different textures for the dog, so it keeps it interesting and keep them entertained for that long 8-week process. What we're looking for is to see whether the pet's skin quality, their ear infections, skin infections, their itch levels, all those things have to improve, if not completely disappear, throughout that 8 weeks, and usually more so towards the very end. And then we would re-challenge their diet with what they were eating previously. So whatever dry food, wet food, treats, snacks, leftovers, whatever, we then introduce it all again at the very end of the 8 weeks, and then we see sort of what happens. So if they flare at the end of the elimination diet, meaning the skin infection comes back, they're really, really itchy all of a sudden again, they're licking their paws, scooting on their bottom, they've got an ear infection, something in that old diet must have triggered their immune system, in which case we know that food or protein is a trigger for that dog. If nothing happens and the dog sort of plods along, maintains the same sort of level, it's unlikely to be food. The most common places that owners go wrong would be the oral flea and tick supplements. So lots of those products are flavoured. Feeding them, just a little bit of toast or a little bit of peanut butter, for example. You think just a little bit couldn't possibly hurt them, but there are some dogs who only take, say, a tablespoon of whatever to flare, and then you're set back right to the beginning again. Don't forget about supplements, so fish oils, young children at home or elderly grandparents, or everyone really has to be on board for an elimination diet. With people who are feeding their dogs sort of generic, maybe supermarket food, sometimes that's okay, but if we are looking to investigate protein allergies, then we don't really know what's in those food, and there's not much sort of quality control standards. And so you really have to flip over the back of those bags and really source through the ingredients to see. Sometimes it's not always what you see is what you get.